All right, so Chelsea and I are doing the Cleft palette, ages birth to 3. A cleft is a split or a divide. A cleft palate happens before birth, and it is an opening in the front of the roof of the mouth. The front part of the mouth is the bony, hard palate, and the back of the mouth is a soft palate that is made of muscle, and you can have a cleft on one or both sides of the palate. There's also a cleft lip, but we are not focusing on that in this presentation. There are multiple types of clefts. We have an incomplete cleft. This is when the palatal shelves are only partially separated. Usually it is only in the back soft palate region that has the cleft, and it can include some of the bony hard palate as well. So we have included a picture here, and this is compared to a complete cleft, so you can see the difference in the pictures there. I'll go back and the complete cleft, the palatal shelves are totally separated. There's a cleft in the hard and soft palate, and the gap extends from just behind the teeth the whole way back to the soft palate. So, yeah, that picture you can really see that it really does extend like the whole way. Next, we have a submucous cleft. This happens when a tissue known as the mucous membrane covers the cleft, and the cleft may hidden, and it is common to not know that is there. I know so many SLPs that not struggle with this, but have recommended that the child gets looked at for a submucous cleft. My boyfriend's mom's actually an SLP, and she was just telling me the other day how she had this one kiddo that they were having issues, and she just found out that he has a submucous cleft, and she's like, well, that would have been nice to know, because you can't just fix that with speech. You have to get that fixed also. But yeah, so these can be a little tricky. The causes of a cleft palate. Clefts are the most common birth defect in the United States. This also includes cleft lips in that statistic, but clefts happen very early on in pregnancy, but the cause is unknown. The hard palate is formed by two bones called the maxilla that can fail to fuse in the embryo and cause clefts. Some risk factors may be genetics, smoking during pregnancy, diabetes during pregnancy, using drugs or alcohol during pregnancy, taking some medicines while pregnant, and poor prenatal health care.
Usually, a cleft palate is seen at birth. It can also be found in an ultrasound sometimes before birth, but it's harder to see because it's inside of the child's mouth. Some signs of a cleft may be weak sucking when feeding or taking too long to feed, or milk coming out of the child's nose. Signs of a submucous cleft may be feeding issues, a bifid uvula, and speech may sound like it's coming out of the child's nose. So the submucous cleft may not be seen until farther after birth. Treatment will begin pretty much right after birth to help a child with a cleft palate, and there is a team of people that will help. A surgeon will usually be able to close the cleft before age 1. A dentist and orthodontist will straighten the teeth and jaw. The SLP or nurse will look at how the child feeds and swallows, and the SLP will also look at how speech and language develop, and then an audiologist will check how the child is hearing. Babies with clefts may have issues with breastfeeding, and bottle feeding is sometimes the only option, and they might need a special nipple to suck on so that they are getting the nutrients that they need. And an SLP can actually help the family to find the best bottle for the child. A child with a cleft may need help from an SLP to learn how to make sounds correctly and speak clearly. Some children have issues with their soft palate, where it cannot reach the back of their throat to make certain sounds correctly, which is called a VPI or varipharyngeal insufficiency. Sometimes surgery is needed for this, or a device can actually be placed in their mouth to help close that soft palate when they're speaking. Specific sounds children may have trouble with are dentals, labials, palatals, labial dentals, and fricatives, and all vowels are likely to be hypernasal. And speech therapy will be needed for about half of children with cleft palate, usually focusing on articulation and hypernasality, and fricatives as well. Some treatment approaches include holding a mirror underneath their nose and asking them not to fog up the mirror when they talk, or by making it a game for them to pretend to be a snake and hold the S sound. They might also have problems with the CH sound, so they can pretend to be they can tell you what sound a train makes, just so that they're practicing that sound. And it also makes it fun because this age range won't have that much of an attention span, so it's important that it's fun for them. And the SLP should also be aware of developmental milestones with this age, just before and while speech therapy is happening, to make sure that you're giving the child the right treatment.